Good afternoon, everyone. My name is Mike, and I'm a clinical consultant with OFMQ, or the Oklahoma Foundation for Medical Quality. Today's HIE office hours topic of discussion will be disaster recovery. Our presenters today will be Dr. David Kendrick, the My Health Access Network CEO, and Misty Larkins, OFMQ's Security Risk Management Officer. Before we get started, just a couple of announcements on the session's decorum and some program reminders. As far as today's decorum goes, panelists, please mute yourself when you are not actively speaking. Attendees are automatically muted in the webinar. To speak, please utilize the raise hand function and a host will unmute you. We are also using the Q&A function, so feel free to ask questions there. The presentation slide deck will be provided in an email following today's session. And today's session, as well as past presentations, are available on MyHealth's websites. And you can see there from the MyHealth website resources and HIE office hours. Couple reminders on the program, the OK Shine connection fee assistance. Again, that is eligible. Any licensed healthcare provider in the state of Oklahoma is eligible for that funding. Again, this funding will cover all one-time connections from MyHealth to get providers connected to the state-designated health information exchange. Other fees may be considered, and that funding is extended beyond that original date of June 30th. So good stuff there. The link is provided in these slides. You can see that there. And then additional incentives here for your Sooner Select patients. You can see there's an additional 9.5 for Medicaid providers who participate in MyHealth, and that is for both sending and utilizing the state health information exchange. So if you haven't already done this, please apply for the OK Shine connection assistance as well as to MyHealth there for those Sooner Select incentives. All right, the presenters today, again, will be Dr. David Kendrick, CEO of My Health Access Network, and Misty Larkins, our Security Risk Management Auditor. First slide here. All right, Dr. Kendrick.
So the topic today is one that frontline providers don't often think about until there's a big issue or an outage of some kind. And so it's kind of near and dear to my heart as somebody who supports the building of infrastructure to improve health and outcomes. And so I'm going to ask Misty to sort of guide us through what's needed. Those who wrote HIPAA and created the Meaningful Use program and other certification programs have built into those programs a number of things that healthcare provider organizations need to do to make sure that we're insulated against these kinds of disasters and cyber attacks and things like that. And so Misty will tell you about those requirements, and I'll tell you how health information exchange helps to recover from those events. Next slide. So the reason for doing this, obviously, it's no surprise to anyone that there are in emergency, there's a rise, for example, in cyber attacks as one cause of these, not to mention other disasters like flooding that recently happened in Connecticut of all places, but other storms, specifically tornadoes such as we have in Oklahoma, that can really interrupt the delivery of care and services. And this is just sort of a list of impacts, I think, starting with the most important, right? We have to maintain patient safety and continuity of care. We have to enable an efficient emergency response and recovery. We have to ensure that we remain compliant with regulatory requirements and preserve privacy, for example. And we have to prevent financial and operational impacts, which can, really severely affect an organization, and help to protect the reputation of organizations as well by having a good failover. Seeing a login screen. And what you can see here is that healthcare has had just from 22 to 23 had a 22% increase in cyber attacks, just as an example of one cause of these things. Next slide, please. And so the first question is, well, what are the potential things that could go wrong? And it's not always the most pleasant thing to contemplate, but it's incumbent on all of us as providers of critical infrastructure for health to step back and take a look at these things. Misty's going to walk you through them, but of course, you know, the natural disasters are on the rise, as we know. Cyber attacks are on the rise, as we know. Infrastructure has become more complex, cloud-based. Lots of more intermediaries between us and our data, for example. And then, of course, we just came out of, you know, a significant pandemic and other public health crises. I think monkeypox is looming on the horizon now as we speak. So this is a wide range of things we need to be thinking about. Next slide.
So from the regulatory compliance perspective, we'll just take a look at some of the requirements under the HIPAA security rule. Most of the contingency plan requirements are really under the administrative safeguards. As you see here, you know, you're really going to be required, business associates and covered entities are going to be required to maintain those contingency plans, documented policies and procedures for how you're going to respond in the event of an emergency. And as Dr. Kendrick just mentioned, you know, there are all types of emergencies that we face now in our world, natural disasters, fires, you know, cyber attacks, and really the ransomware incidents are definitely on the rise, and I think will continue to rise. So really there's the implementation specifications that we'll look at. There's 6 implementation specifications that are required under the HIPAA security rule, starting with the first one, which is going to be developing a data backup plan. And we'll look at that on the next slide. So as far as the data backup plan goes, I think I want to point out just first and foremost that in order to do a data backup plan, you really need to identify where your EPHI resides within your environment. There should be a robust backup strategy for all of your EPHI resources. That's critical to your IT operations and also, you know, very important in the event that there is a cybersecurity incident. The HIPAA security rule does require organizations to have those policies, procedures documented. So really you need to identify where your data resides, how that data is being backed up, and then also, you know, how the backups are secured. In addition to that, I just want to say that, you know, a lot of times people will immediately think of the EMR, but I just wanted to point out here that, you know, you really need to figure out where that EPHI is outside of the EMR, you know, labs, diagnostic images, all of that EPHI data needs to be backed up. And making sure that you have those fully recoverable backups is very important, but also just as equally important is making sure that you're testing those backups. So make sure that your restores are being tested. That's essential to determining, are you able to restore your data, and can it be restored, you know, at the point where it needs to be restored, and then also within the time frame that's needed. When you do those backup tests, make sure that you're documenting those. You know, if there's revisions that need to be made, go back and make those revisions. And then also, you know, Dr. Kendrick mentioned the cloud environment now. Anything that's off-site, make sure that those off-site backups are sufficiently protected as well. In that regard, you know, we really want to think about encryption and access control mechanisms are pretty essential in that regard. And I think, there you go.
So what does it mean to include health information exchange in your backup plan? And I obviously health information exchange can apply to every one of the requirements. I'll start and give you some detail on the backup plan section because it most relates to where are copies of your data and how available are they to you. So the way My Health works and all health information exchanges work traditionally is we have a live data feed from each organization. And that means we receive messages almost in real time, maybe a minute delay for registration events, when patients are roomed, when they move up to the floor, when they're prescribed a medication, when they're dispensed a medication, when a vital sign is taken and documented, when a clinical note is signed. All of these things, when a lab result comes in, all of these things come in near real time to the health information exchange, which makes it a unique and highly available repository of every organization's information. And that's by design for our primary use case, which is when patients receive care in another locations, their records are there. But I've literally sat in the emergency room and taken care of a patient and watched as the data flowed right into the health information exchange as they moved from the waiting room to the bed, got vital signs. Those were all being added to the chart. So it makes a very convenient backup of the systems. And as you can see here from the data types, it's fairly comprehensive of everything that would everything that would be needed to take care of the patient. Next slide. So in terms of making regular data backups, and there are a lot of words here that describe sort of the textbook version of what everybody should be doing. But if you can click again, I'll just say where My Health and the Health Information Exchange world fits here is that we're essentially doing a full backup in real time, depending on how comprehensive your organization's data feed is. And to my knowledge, we've never turned away a particular type of data or data feed from an organization. So if you were to want to make sure that the Health Information Exchange had even more robust data than our standard package, we most likely would be able to take it. So in that sense, we're really a full backup of clinical information. We don't tend to take your, say, internal audit logs on who accessed what chart when, but we certainly take information that I showed you on the previous screen. And again, that frequency is generally real time, which is very powerful. Next slide. Also from an architecture perspective, the MyHealth system is cloud-based and it's stored across multiple regions. And it's a high trust certified environment. So I want to unpack that because those are all critically important things to having your not just a backup, but an operational data store available in another place. One, being cloud-based and multi-region means even with a large cloud outage that affects one entire region of the United States, the system would still be able to be up, running, and functioning. And then being in a high trust certified environment means that it has at least, if not many more controls around it, even than your own local instance of your electronic health record system. That's an expensive and difficult to maintain, achieve first and then maintain certification that says we have, the highest levels of controls around every access point, audit logging, hardening of the systems, and so on, so that they can't be accessed by outside folks. And so MyHealth deploys the highest level of these requirements. And I think that makes it a more credible backup system or consideration for being part of, at least, every provider organization's backup system. Next slide. Then another key element of data recovery is how quickly can you get to the data? How long does it take to get to a full recovery time and to what recovery point? And I will say that at MyHealth, since the data flows in real time, we often are among the first to know when an organization's EHR is affected or when their line goes down, because we see that feed, which we monitor continuously, go down as well. And the data in MyHealth is maintained at all times, going all the way back in time. We have some clinical events going back to prior to the year 2000 even in our data, so we don't periodically delete things. And it's up to date as of the moment of the event or the feed being cut in the organization. So that care can be delivered up to that point. In terms of how quickly systems can be restored, the first step is how quickly can you resume care, continue seeing patients or take care of patients that may already be in your hospital on the floor or waiting a surgery. And the answer to that is, as long as you have providers who have user accounts with access to the MyHealth portal, then those lab results, those notes, those things will still be available and care can resume and continue largely uninterrupted. So that's one step. Another thing to note about MyHealth is that our data is stored in what is now the nationally required standard, which is something called FHIR. It stands for Fast Healthcare Interoperability Resources, version 4 of that data, which means that it's in a common standard data model, regardless of what hospital or clinic the data comes from. And what that means is that we have an application programming interface, an API, that an organization could conceivably query against to replenish their data. And we've been testing the performance of that recently with our data scientists, and we've discovered it enables pulling of full charts at the rate of about 11,000 per minute, which is pretty high volume ability to provide access to the data, and I think makes health information exchange structured like MyHealth a credible part of your disaster recovery strategy. Next slide. All right, so testing is critically important. You can't just put words on paper and throw that piece of paper in a 3-ring binder and set it on the shelf. That's enough to check the box, but that doesn't save you when you have an actual outage, cyber attack, or a disaster. I couldn't find it, but I have a photograph of disaster recovery procedures in a 3-ring binder floating in a flooded office. That sort of brings home the point that you actually have to test and use these things. Next click. And so MyHealth is willing to participate in, or even if the MyHealth participant community would like to help host disaster recovery exercises. We've had organizations even recently who've had to use MyHealth for part of their disaster recovery. And every time that happens, we find a gap. We learn something we wish we had done in advance. We wish we'd created more user accounts in advance, or we wish we'd done more training at the frontline level in advance. So just to point out that as a membership participant organization, MyHealth works for you all. So as your IT teams and your compliance teams are working out these plans, obviously we can't do a custom test for every one of 600 or 700 organizations that participate in MyHealth, but it would certainly be reasonable to do some group exercises that we could support. Next slide. All right, Misty.
And really, this slide just kind of backs up what you've already covered, but another implementation specification is to establish a disaster recovery plan. Again, the goal of that is just going to be to restore the operability of your information systems, your applications, your computer facilities, and do that in a documented plan that says, these are the individual responsibilities, like you said, identifying your loss and impact assessments, what are your recovery priorities and objectives, and really just the step-by-step procedures for recovering your information infrastructure and access to your EPHI. Looking if you're going to have an alternate work site, if you have to move to an alternate work site, then that would need to be included in your disaster recovery plan. And again, just to reiterate, this should be for any kind of disaster, not just a fire or flood like we see a lot of, but today more of the cybersecurity incidents.
So how then do you build health information exchange in your disaster recovery plan? I've talked about a number of items in those call outs, but I want to sort of reinforce some things. MyHealth is online and available all the time. Nobody in technology ever says always or never. So there's definitely a potential that the system could be down. But for example, when everybody had the outage due to the Windows upgrade a few weeks ago, MyHealth was unaffected by that and was available throughout as everybody was getting their blue screen of death or whatever. We work hard to make it that way. That's really our primary focus as an organization, is privacy and security, and making sure the systems are live and available. We allow that seamless data exchange uninterrupted, and to ensure the continuity of care, continue to enable the real-time coordination, and I'll tell a story about that in a moment, one of our real-world examples. We've been pleased to see that our system scales very well. During recent events, we had utilization go up triple, quadruple in a matter of hours without any impact on the availability of our systems, no reported outages. You really can't pressure test systems fully without 1 million people willing to log in all at once. But we were able to demonstrate that, dramatic spikes in utilization and access of systems are not really affecting things adversely. And then, of course, on screen, you see a picture here that shows the system is available on a desktop machine, on a tablet, or even on a mobile phone as needed. So that really opens up options for those who need to be able to continue to deliver care under difficult circumstances. Next slide.
And actually, that just dives right into the next slide on the emergency mode operation plan. This is one of the standards that I feel, or implementation specifications that I feel a lot of organizations aren't real clear on how to implement a plan like this. But the HIE is a great way to do that. It's really just developing a plan for what you're going to do to continue operations in the event of an emergency or a disaster situation. What business processes are critical, how you're going to continue seeing patients, how you're going to access that EPHI, if there's a technical failure or an outage of some sort. Really just making sure that action plans are developed for responding to these types of emergency situations.
So, kind of just to say it again, because that's really the thrust of this whole discussion today is, making sure that, before the crisis occurs, that you really understand that your data feeds are complete and they're high quality and that that meet the required standards, so that when you need to depend on them to deliver your own care, based on the data you sent us, you don't feel like you're having to eat your own dog food, but instead you're having some filet mignon from your own medical record system, right? And I, again, when we get to real world, I'll tell some more stories about that. But the notion of real-time data replication, providing the distributed access across multiple systems, but no sacrifice in security by doing that, right? And then having backup communication channels as well, which are all available through these systems. Next slide. All right, so here's a first real world example. I pulled this in part for Steve, our state coordinator, who I think is on the call as well. This is a real world example going all the way back to the days of SmartNet, which was officially the first health information exchange in Oklahoma. My Health and SmartNet merged in 2012. And we're still in the process of merging their technology at the time that this tornado occurred. Devastating tornado in Moore. We've, for whatever reason, Moore is in the line of targeting repeatedly and has been. At the time of this particular tornado, SmartNet was providing really a critical service. What you see in the top picture there is the neighborhoods that were struck, which were absolutely leveled and devastated. And then the bottom right-hand picture, you see the healthcare facility, which was itself not in too good a shape. And so the users that needed to be supported here were first responders, right? IMSA on site, fire departments on site. Those are both very active users of the MyHealth system today, in part because of the lessons learned from this work. And it's more than just knowing whether the patient is on a particular medication that's important, right? For example, because we have the master person index, one can determine how many people may live in a household, and therefore how many folks need to be expected or found for rescue if there's a collapsed building or home, right? There are other uses of this data in these of the MyHealth and HIE data in this. For example, we can prospectively determine who are the patients that are dependent on electricity, right? Who's on a home ventilator, home oxygen, who needs insulin that's refrigerated, right? These are all what we would call electricity dependent patients. We should find those people in advance and direct rescue efforts there in prioritized order, for example. I learned that in particular when I worked Katrina way back in 2005. We had a lot of difficulties with that. So those are all opportunities by doing the pre-work that go kind of beyond just checking the boxes in your own compliance documents in your organization, but to starting to think about the disaster recovery as a community level effort and being able to contribute to it and make sure that it goes well. And so again, SmartNet was heavily used in that scenario, big spikes in utilization and helping, as I say, not only find medical records when those patients showed up in facilities with medical needs, but also helping to find next of kin and contact information and other pieces of information that we have in our systems. Next slide. A more recent example, more modern example of this is cyber attacks, and those are happening more and more frequently with whole health systems going offline. They lose not only the access to their electronic health record system, but maybe the internet in general because their networks are unstable or vulnerable to the attack. they shift to 100% paper documentation. We've all heard the nightmares of whole generation of providers who've never used anything but an EMR. They don't know how to write on paper what the SOAP note is, or to write ADC Van Demmel orders for admission, or whatever moniker you like to use for that. And so so that's a big enough challenge to shift them to documenting on paper. But now they're trying to take care of patients with no histories, no ability to get the results of labs, even though they're ordering them on paper requisition forms. Those lab results have no way to get back to them in many, if not most cases, based on what we just experienced. And so not only do you have to have the shift to paper, but you have to have some digital availability of the record, as we've talked about. And even more than that, you may have to access that record over over 5G or your mobile phone service. And so it needs to be performant. It's not automatic. That a mobile app on your phone can pull down a full chart on a patient. And so MyHealth is also tested to make sure that you can work over regular mobile device connectivity, AT&T, Verizon, and the others, and remain highly performant in those settings. So in this case, I think you can see here in the bar chart, this is weekly data during an outage, and you can see the dramatic increase in utilization. This is number of unique patient charts pulled up per week. And the yellow bars, which, as you can see from the left part of the graph, were far and away the majority of users. Those are like support staff, nursing, and others in a healthcare system. And the red bars are actual licensed healthcare providers, those making clinical decisions. And you can see the dramatic rise in all utilization and access to the MyHealth portal during this cyber attack, but in particular, the rise in providers accessing the system. And I know from having lived through this that, first of all, executives in the organization were shocked to find out that within minutes of systems going down, their providers had cut over to using the MyHealth portal for continuing to deliver care and getting access to records. And then throughout the crisis, more and more types of providers, including radiologists and pathologists, began to use the portal as well, which had never used it, even though it was always available to them. So unfortunately, you've heard the phrase never waste a good crisis. This was a scenario where we gained new types of users on the portal, people who now have this new tool in their toolbox to go to when they need outside records and information. I think that this really made a big difference in their ability to continue to see patients uninterrupted, to avoid major safety problems, and to get back in the game of patient care. You can see there clearly where it dropped off when their EHR came back online, but even though that occurred, they continue to have higher than ever utilization from prior to the outage. Next slide.
And so for the testing and revision procedures, I think really I just want to say with that real life events that Dr. Kendrick just mentioned, it's probably best not to wait until you have those types of situations to test your disaster recovery and your contingency plans. But the HIPAA security rule does require you to test and revise your procedures. So, make sure that you're testing these plans at least annually. You can do like the live test. If you have a live test and it thoroughly tests a set of resources, then go ahead and document that. That is your test for the year that you're doing. You can also do walkthroughs, scenario-based walkthroughs. Like he mentioned, do these group exercises, involve all of your key personnel and all of your key departments in those exercises. And then as you go through those exercises and you document your findings, where there are gaps, like you said, make sure that you make changes from that. Put those corrective action plans in place and update your contingency plans to improve the overall procedures, so that when you do have those live events, you're ready to respond accordingly. Next slide.
So from a health information exchange perspective, based on recent and older experiences, for example, one of our colleagues in Buffalo, New York, had a health system that was under a ransomware attack, and they were able to actually replicate their data from the Health Information Exchange. So there are examples all over the country of these things going on. And in fact, sort of as an aside, one network that a CEO that I spoke with has been investigating whether health systems and providers can get a discount on their insurance by having a health information exchange there at the ready to continue to take care of patients. Still, more news hopefully forthcoming on that. So in terms of how, there are a lot of things we can do to prepare. If you're a clinical organization, hopefully you're in queue to have a single sign-on implemented to really streamline your providers' access to the data in real time when they're taking care of patients. But as you know, that single sign-on could be vulnerable if the EHR goes down, meaning they will no longer have access to the single sign-on button if they don't have access to the EHR itself. And so in those situations, our recommendation could be something like, hey, maintain a list of all your active EHR users with the required information like mobile phone number and a good email address that's not dependent on your systems that you can quickly transmit to us, and we can in bulk manually create the user accounts so that you can be up and running within literally hours to minutes of an event occurring with actual logins, which we will not generally do for organizations that have single sign-ons, but we can certainly do in that scenario. Other things like sort of pre-caching the folks who are electricity dependent or who are particularly vulnerable and need to get special attention during disasters can happen in this pre-planning as well. Next slide. So the regular testing and improvement, again, we would offer, and it would be a good exercise to do in partnership with the state as well around their disaster planning to do some tabletop exercises, if not some digital exercises here. Next slide.
The final implementation specification here under the HIPAA security rule is the application and data criticality analysis. And really, this is just making sure that you're doing a software and a data application and data inventory. Make sure that you know where all of your applications and your data, what you have in your environment, and then going and doing an analysis to figure out, what's the most critical elements to be restored in the event of an emergency or a disaster. Making sure that all your IT systems and software are also regularly reviewed. So once you do this application and data criticality analysis, make sure that that's regularly reviewed. Really, the goal there is to ensure that your recovery objectives can be met in the event that you are having to go through a disaster scenario or an emergency situation and go through that data recovery process. And I did want to include this slide just to show that the OCR does provide a lot of guidance when it comes to the HIPAA security rule, specifically as far as the contingency planning goes. They have these elements that they have established that they've shared with organizations. Really, the goal of the contingency planning requirements under the HIPAA security rule is to be able to maintain those critical operations and minimize your loss. Making sure that your time periods are defined. Also, who's going to activate the plan? At what point does the plan get activated? In addition to that, make sure that your disaster recovery contingency requirements are, documented and shared with the employees. If somebody has, key responsibilities, they need to be aware of those responsibilities. Again, going back to just the testing, making sure that that's tested, making sure that the plan is updated after you do those tests. If there's gaps that need to be filled in, then, make those changes to the plan and then redistribute those to staff and make sure that they know what their responsibilities are and what the responsibilities of the organization are.
Great. So, bottom line is MyHealth wants to work with each of you as organizations through our governance and individually if desired to help make sure you're ready for disaster recovery, not just in the sense of checking the boxes, but in the real sense of being able to continue to serve your patient population and help the community through a disaster. Next slide. All right, Mike.
All right, everyone. Well, you can utilize the webinar chat or the Q&A feature there in Zoom if you would like. Again, this session was recorded and will be available on My Health's website. So feel free to ask questions if you have any.
I have a question for Misty, if I can ask.
Sure.
So Misty, you work with a lot of organizations in helping to create these policies and processes. What do you find, or what do you think organizations find most challenging about meeting these requirements?
So I will say there's two parts, I think, to my answer. Number one, nobody has time for documentation. So from the HIPAA security rule perspective, I feel like that's the big part of the contingency planning requirements is, maintain your documented policies and procedures. But I think more importantly, maybe just the fact that we're in this environment now where these cyber attacks are happening so frequently and on such a large scale that knowing where to start and how to, get access to data if this does become a situation that you find yourself in is scary for the people that are in charge of putting those plans in place. But I think just preparing for that and the resources that you provided, I think are going to be hopefully very helpful for people to understand how to at least approach that. Because I think really with those cyber attacks, the number of data breaches that's occurring today, specifically in the healthcare environment, is frightening. And really, I think that again, the challenge is how do we recover? How do we still see patients? Because 5 years ago, it was you might have a paper chart that you're looking at, but like you said today, everything is so digital and stored, in that electronic format that having that emergency access right then to be able to continue seeing patients has got to be, first priority. So I think both of those, and hopefully, we hear that the HIPAA security rule will be changing a little bit. So hopefully it'll be incorporating some of these clearer directions.
So you're thank you. That's really helpful. It reminds me of two things that I wanted to mention. One, if there is standard language that My Health could provide to describe how it works and what it does and how it meets the requirements that could apply to all organizations, it would seem like we could maybe pull that together and share it with participants so they could just sort of insert that in their 3-ring binder. And then the second thing I would say is I have observed as My Health builds data feeds with organizations that sometimes organizations have outbound data feeds that they've had for years to software vendors. In some cases, they're not even working with anymore. And I know that, CIOs are probably peppered with requests from other executives for each of their pet, vendor products or quality measurement products or whatever. And hospitals and clinics may be asked to make one-off connections to lots of different things. One way I've always thought that an HIE like My Health can help is to say, look, our whole job is to monitor what data comes in and what data goes out. And if you've got a live feed to My Health, then work with our team to get data to your vendors so that it's got all the monitoring wrapped around it. And if, staff turnovers happen all the time in clinical facilities, and somebody loses track of a feed, you don't have to worry that it's not monitored anymore.
Yeah.
All right. Well, I don't see any more questions in the chat or in the Q&A. I want to offer the option to put something in there. If you have a question, don't hesitate to ask. Wow, we might have something here. Okay. Lucretia has put in some takeaways from the meeting. All right, everyone. Well, thank you for joining us. Again, this session has been recorded and there are other sessions recorded on My Health's website. Please check those out. Thank you for your time and have a great rest of your day.
Thanks all.